Hello. World over, I suppose other countries know more in the way of home remedies than we do in this country. But as I have traveled around the world, I have learned many home remedies. We'll be talking about some of these home remedies in our program today, and so we hope you'll join us.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of UG Pines Institute. And now, here's your host, Dr. Thrash.
Everywhere I go, I ask people for various remedies for diseases. And often somebody tells me a remedy that I've never heard of before. And so some of these remedies I'm going to be talking with you about today. And my assistants will help me to present other remedies, some of which I have heard of and some of which I have not. And so today I have some things that most everybody has heard of and knows all about. And one is something that you should have somewhere about your equipment if you do much in the way of hiking in mountainous areas. This is a splint for a leg, and so you may want to have that in your equipment. Now, if you have someone in your home who becomes an invalid, then you may want a device such as this is. This little device can help you if you are in bed for a long time. You simply extend the end of it, as you can see here, and then you can pick up a lot of things. And it has a good bit of force, as you can see. It's putting a good bit of pressure on my finger. So you can pick up things and draw those things back to you so that when you're lying in bed, you don't have to call somebody every time you want something. I don't think it would pick up a glass with water in it, but it will pick up a lot of things, and that can help you a lot. I have found that something called white oak bark can be most helpful for people who have a problem with a lot of tonsillitis and pharyngitis and laryngitis to make the tissues less swollen and to make it so that they can talk better. So white oak bark, very good for that. And then red clover is also good. Many companies produce this, but the red clover is very good for women who have menopausal symptoms. It's good for people who have menstrual upsets like prolonged menstrual bleeding. It's also very good for painful menstruation, and I like that very much. And then I have here a substance called Nutribiotic, and Nutribiotic is a very thick liquid, and you can see here that it is quite a thick liquid. It is made from grapefruit seed, and about 8 drops of this in a quart of water will give you a very bitter water, but it's quite good for a cold or a sore throat. And if you're in a position where you really don't want to come down, you really don't have time to indulge yourself with a few days in bed nursing such an affliction, then you may want to get something of that nature. Here is chaparral, another very good antiviral material, and I like this very much. I think that the antiviral properties of it have been undervalued and can be very helpful to people. It's an herb that grows out west, and you can get it in tincture or you can make a tea from it. It has also been used as an anti-cancer. I have in my home kit something like this. It's an otoscope and an ophthalmoscope, and you're very familiar with those. You will not need an ophthalmoscope for sure, but you might need an otoscope, especially if you have elderly people or children in your home, to look in the ear to see if the eardrum is or the ear canal may have something in it or might be inflamed, and in old people to see if they have an ear canal filled with wax. So the wax that an old person has can be very deafening for them, so that they cannot hear anything. I like these under patient bed pads. They are very good for a wide variety of things, and one thing that I use it for is to make a charcoal compress. If I need to make a charcoal compress to go over, say, the entire back, as for a person who has a kidney failure, then I'll make the charcoal substance, and I'll open it up, and you'll see this little filmy part here that the chucks has, and you'll just open it up, and then you can put the charcoal powder on the part that has the cotton on it, and then put the filmy part back down, and the charcoal is all in here. You can put that on the back of a person who has kidney failure, and the next morning when you take this material off, you will find that it smells like urine, and indeed the charcoal will absorb into itself the toxins that the person who has the kidney failure will be giving off. So chucks are very good to have on hand as well. Now I have a back brace that can be used when a person does not have a backache, or it can be used after the person already has a backache. And I have asked Ariana Hartsfield if she will come with me and help me to show you this very nice little device. Ariana is one of our students in our elementary school, and she will help me with this. So it is simply used in this way. It is placed on the person's mid-back so that it rests a little bit above and a little bit below, and then it simply goes around the person, fits on like that, and fits together with the Velcro. Then they wear it all day when they're doing their work, and it can be most helpful for them. It makes it so that when they bend in a very helpful way. Now, Ariana, if you will just stay here with me, I've asked Miss Rhonda Clark if she would tell us something about how to handle pigmented scars and other problems that can be very threatening to the cosmetic health of a person. What can you tell us about scars?
When someone has a fresh wound or a fresh incision, once the sutures have been removed and the wound is sealed, you should begin regularly massaging that area using some type of a lubricant on the skin. You could use something as simple, for example, as olive oil. Olive oil is a wonderful lubricant, and you might, if you wish, even add a few drops of aloe vera gel to that to add, a nice healing component to the olive oil. Something just to smooth and lubricate the skin on that area. That will help prevent a scar from really building up heavily, help prevent as much of the keloid type tissue from developing. And it's important that the person should avoid sunlight with a fresh scar, since that can be a contributing factor to the darkening of scars.
I have found that for people who tend to develop keloids, that if they take a very simple diet, low in fats, low in sugar, low in heavy proteins, a totally plant-based diet for about 2 or 3 months after heavy injuries of some kind, serious injuries that one could expect would result in keloid formation, which is the humped up scar that can be so disabling and unsightly. That can be of help too. But I'm glad to learn about this other for keloid.
If a scar is heavily pigmented and it's a fresh scar, a new scar, one of the things that is recommended is something called rose hip oil. It's high in retinoids, and you may think of retinol or Retin-A, some medications that are used in acne. It can have the process of lightening that scar and helping it to continue its final healing stages without darkening. If you have a scar that is pigmented and it's one that you have had for a while, there are some things that you can try. They're not always effective, but they're certainly worth giving a try. One that I have brought to demonstrate on Miss Hartsfield is a simple slice of cucumber. I've just placed it here in a little aluminum foil, but a slice of cucumber has quite a moistness to it, and it is this cucumber juice that is the lightening agent in dark scars. On Ariana's hand here, she has a very small but slightly pigmented scar, and the cucumber juice can be very easily applied. Just a thin application is all that's needed. It's just rubbed lightly over the area, and this would be left on overnight and then just simply rinsed away. You can see here on the side of her hand she has another one. This is good for people who have acne scars that have been pigmented, or any type of scar that has a heavier pigmentation to it.
So it just dries and she wears it overnight?
Yes.
And then the next day she could apply more if she wished?
Yes. And it's surprising how much juice is in even a thin slice of cucumber. One or two slices should be all that's needed, even to use on the entire face if there are acne scars, whatever.
Does it pigment normal skin?
It shouldn't. It shouldn't. It should really focus on the scar area. And some others that we know of are lemon juice and lime juice. Those have a bleaching property, and that can be used in conjunction with the cucumber juice. You can even blend a little cucumber and lime together in a blender, soak cotton balls in that, and then use those cotton balls to apply to a larger area that has darkly pigmented skin. So those are a few tips for treating scars.
Fine. Thank you so much. I appreciate your showing us this. Thank you.
Sure. And I had brought something else to talk about today,
Wonderful.
which is another thing that I just happened across. One of my responsibilities in my work at UG Pines is to counsel people who call on the telephone with medical questions. And we recently had a call asking about natural treatments for glaucoma. I had not researched this in the past and found a few things that I thought were interesting that may be of use to you. For glaucoma, it's of course important to avoid anything that increases the pressure inside the eye. This is what eventually damages the sight. And so things to avoid include caffeine, tobacco smoke, and even if you don't smoke, if you are around secondhand smoke very much at all, this can contribute to an increased intraocular pressure. So avoid even secondhand smoke. Exercise is very beneficial. In fact, one study said that walking 40 minutes 4 times a week had an entire group of people with glaucoma come completely off of their medications, their prescription eye drops. And so I thought that was rather interesting.
We know that some of the same things that treat glaucoma, which is increased pressure in the eye, will also treat high blood pressure. And walking is a very well-known treatment for high blood pressure.
For high blood pressure, indeed. Some other things that were helpful were to avoid any kind of allergen. If you are allergic to pet dander, molds, pollens, any of those things, limit them in your environment as much as possible. Avoid activities that are straining or that are heads down, so no handstands or headstands for you. And when you protect your eyes with sunglasses, it's important to get a level that is appropriate. They should block, on the sunglasses, it should say they block up to 400 nm of the UV rays. That's the appropriate prescription of sunglasses to have to protect your eyes in the event of glaucoma. Controlling hypertension, blood sugar, very important, and increasing the intake of vegetables and fruits that are high in vitamin C, vitamin A, and also the whole grains, which have some of the trace minerals of zinc, chromium. These things are all beneficial for someone with glaucoma.
Very good. These are lifestyle changes that are within the reach of everyone.
Yes.
Thank you so much.
You're welcome. Glad to be here to share. Thank you.
Now, notice that lifestyle changes are within the reach of everyone. Simple things like cucumber and walking and a change in diet. Now, I have asked Dr. Donald Miller to tell us a little bit about the prostate. Welcome to the program, Dr. Miller.
Thank you. Thank you.
And I see you have a device here that you will tell us about concerning the prostate.
Well, let's talk about the prostate as a organ first. And we're going to show you the prostate on the screen and talk to you about how it operates and things that keep it from operating properly. They say that almost everybody over the age of 80 is going to, or every man, of course, over the age of 80 will have prostate problems. But I don't think this is something that has to happen. It's our lifestyle that's our main thing. You can see in the screen the large blue bulb on the top is the bladder. It goes down, it passes through the middle of the prostate. The prostate's about the size of a walnut, and this urethra goes right down through the middle of it. And if anything happens to the prostate in a swelling action, of course, anything that's got a lumen, it's got a hole in the middle, will swell out and it will swell in. This is the proper way it's supposed to look. That it's just supposed to be that nice prostate there. The urine passes through the middle of this and then out of the body. The next slide is going to tell you some of the problems that we can have. And some of these things, as that prostate gets into problem, it starts to grow a little bit large. You're going to have some resistance in that urethra. It's going to squeeze down that urethra, and you're going to have decreased force in the stream of the urine. Now, these things can be basically diagnostic. If you find that, man, I try to go to the bathroom and I don't get much out, and sometimes I got this great desire, but it's intermittent. Sometimes it does, sometimes it doesn't, and like there's something wrong inside. The next slide is going to tell us a little bit more about these problems. And one, you've got this destrucer response to maintain the flow. Basically, there's the bladder is sort of squeezed to get the urine out. But if it's not working properly, you've got this frequency. That means you've got to go to the bathroom quite often because you've got this urgency, which is the next thing there. I've got to go, I've got to go. And then you've got this nocturno, which means in the nighttime you've got to get up frequently. Trouble is you get up and you go because it's still frequent and you've got this urgency, but you don't have much coming out. You're not storing much. So these are some real problems with the prostate.
Yes. And I can see that it's the growth of the prostate that squeezes on the urethra.
Yes.
Then the bladder overgrows, that detrusor muscle overgrows, and that makes it so that the bladder can't hold quite as much as it did, and the bladder becomes more sensitive.
It's a vicious cycle.
It is a vicious cycle.
Now, when we talk about prostate problems, I first have to point out the fact that there are certain lifestyle factors that's going to lead to the problem. Rather than talking about lots of remedies to remedy the problem once we have it, let's talk about just a few very minor things, or a few things that I can mention to you. One, those who eat a lot of lycopene, red fruits and vegetables, 10 servings a week will reduce your likelihood of prostate cancer by 45%.
Oh, that's significant.
That is very significant.
It makes me like tomatoes and watermelon even more.
And the neat thing, you know, people go on these all-raw diet type of things, but the thing about the tomato, when it's cooked, is even more effective.
I heard that it concentrates the lycopene.
That's right.
And it does not destroy it nor damage it in any way.
Well, that's the nice thing about phytochemicals. They're not damaged by heat.
Yes.
God has made just what we need to take care of ourselves. And so 10 servings of red vegetables and fruits a week is not a real hardship case. I mean, how about strawberries, watermelon in the summertime?
I could go for that diet very easily.
I like that diet very much too. Another thing that promotes the prostate cancer, those who frequently drink dairy milk over those who infrequently drink dairy milk have a 50% greater risk of prostate cancer. So those who've been telling you drink your milk every day, that's not the very best thing for your prostate. And if you're a man, or even for a woman, because it's leading to all kinds of problems with women, with breast cancer and osteoporosis. And so,
you mean milk might cause osteoporosis?
Absolutely it does.
Yes, apparently every country of the world where there's a high milk intake, there's a big incidence of osteoporosis in women. So it's apparently part of the problem and not part of the solution.
Absolutely. Another thing that's rather interesting, if your resting pulse rate is over 80, you have a greater risk of prostate cancer. And so what does that mean? You're not getting enough exercise. And exercise in itself is protective and is curative.
Yes, it strengthens the muscles of the pelvis for a man, and that massages the prostate and makes it more healthy.
Massages the prostate, which is one of the things that we can do perhaps sometimes to help the prostate once you've already developed a problem. It's sort of a digital massaging. But there are other things that we can do. We recommend sometimes hot sit baths. Now, this is not just for prostate. This prostate cancer or a enlarged prostate. It's good also for hemorrhoids or fissures. And that's just sitting in a bucket of hot water. Very soothing and very healing. But there's a little device that came out a few years ago, basically for hemorrhoids and anal fissures, which we've also been have heard it is good to be used for prostate cancer. And it's this little device is called a thermotherapy device. And what it does is it's got a little wand, if I can call it a wand, a magic wand, that inserts into the anus, into the rectum, and when it's in there, you turn on the temperature dial. It goes between about 37 and 45 degrees. We usually start at about 38, 39 degrees, and for about 20 to 30 minutes twice a day. And the way we do this is we take the wand. It comes in these special little cots that you slip over the end of the wand, and then you can lubricate it with some KY type jelly, probably even Vaseline would work. You lubricate this, get in a comfortable position, and insert this into the rectum and just leave it sit there. It's got a place where it won't go any further than this. It's going to get up against that anal sphincter and hold it in place. And turn it on. This gives you some good localized heat. So
Sounds very helpful.
Well, you're not sitting in this big tub of water. It's much more convenient, I'm sure.
Yes.
And it gives you local heat. And basically, this is just about far enough to be affecting the prostate. Because when you do a digital examination, you can examine it well with the whole pad of your index finger. And so this is going to be right in that area to give you some localized heat, which is going to do a few things. It's going to bring more white blood cells to the area, which is very healative to the body. Is also going to cause the heat itself can kill cancer cells, and so it's something that's worth a try. If were having prostate problems, and I don't anticipate this because I've tried religiously for the last 20 years to live a lifestyle that will keep me healthy.
I know that you get plenty of exercise.
Plenty of exercise.
And your diet is not high in fat nor high in sugar, nor full of animal products.
Haven't knowingly put an animal in my product, animal product into my body for over 20 years.
That's good.
And
that should be very protective.
For being around 60 years of age, I think I'm doing all right. And
Sounds
so
good.
These things are very nice. Another thing for the hemorrhoids, which is a real problem, you can take things like, I'll just use this as an example of a rubber glove. You take a rubber glove and you fill the fingers with water or aloe vera gel and put them in the freezer and freeze them. And then when you're having a problem, slip the little ice finger out, whether it's water or aloe vera gel, insert this into the rectum and hold it there. Very soothing for
hemorrhoids and proctitis or inflammation of of the area.
Right. And so simple things that it doesn't require a lot of something like a TUR, a transurethral resection. I would rather go for...
Try to avoid those if possible.
I've seen a few men who have had a TUR, which basically means reaming out that prostate to allow the urine to flow through a little bit easier, and they walk really dainty for quite a while. So.
Of course, I'm sure that for the man who has obstruction, he's very happy that that is available.
Well, it's not only happy, but it's a vital thing.
Yes, hopefully our instruction to the man can help them to avoid that problem.
Exercise, diet, so vitally important to a man.
Proper weight.
Proper weight. Well, that's the number 5 thing. Fruits, vegetables. Eat fruits, vegetables, whole grains, nuts, and seeds. Avoid meat, milk, eggs, cheese, and overweight. So
yes, that's
5
it.
and 5.
5 and 5.
You got your choice, man.
Yes. Very good. Thank you so much, Dr. Miller.
Thank you.
I appreciate that.
Yes.
Now, again, we see very simple things. Aloe vera being very helpful and heat being very helpful. And the lifestyle, of course, and we want to emphasize that. Now, I've asked Cal Thrash to join me to tell a few things about some additional matters that we can do, some things that we can do for sore throat and infections, and also some things about the blood pressure. Cal, welcome to the program.
Thank you.
Now, you have, I see here there is garlic.
Yes.
On your table, so what are you going to tell us about garlic?
Well, garlic is a useful remedy for various things. I use it mainly just to help with getting over colds and that type of thing, but it's extremely good for reducing the blood sugar, blood cholesterol, and also it's good to reduce hypertension.
Yes.
In fact, it's good for thinning the blood, and it's so good that the people who take Coumadin and those types of warfarin drugs have been warned, don't take garlic along with it, because if you do, you'll thin your blood too much.
Yes.
So this is one thing that we can recommend to people as being something that's a good blood thinner if you don't have to be on the prescription.
Yes. Well, I see you have an aged garlic compound there also.
That's correct. This is of course Kyolic, but there are many brands. Basically, it is a deodorized garlic type of product.
So the people who have to meet the public might be able to do so with less offense if they take this?
Yes, in fact, I take it every day. I don't think you can smell it on my breath now.
No, I can't smell it on you, but they tell me that when I take any kind of garlic compound, people can smell it on me. I think there are some people who don't metabolize garlic as well as others, and it can be smelled on the breath. So you have to know who you are and know what to do about garlic.
Some of the other things that garlic is good for is to actually it'll kill intestinal parasites.
Yes.
Under some conditions, and you have to take quite a bit of it for that, but it's certainly a pleasant way. If you like the taste of garlic, you can just use it on your food and also take some additionally as well. And
people who have intestinal worms may be very happy to take all they can get.
That's correct.
Well, thank you very much for telling us about these things. I'm charmed with this little rendition about garlic. I love to talk about garlic. I don't think there is anything that we have in the kitchen having more good medicinal value than garlic. And in addition to that, garlic can be nicely used as a flavoring for food. And many people prefer to use garlic. If they had only one flavoring for food, they would probably select garlic. I'm one of those. I really appreciate garlic. Now, as you can see from our discussion of these simple things, you can take such a simple affliction as a wound or a scar on the hand, and you have something that you can do for that. Some things that may be curative or at least can be helpful. And even if they do no good at all, they have not done any harm, and they have cost very little. All the way from a simple remedy like that to a much more complex remedy like the device that Dr. Don Miller showed us, with the administration of heat through a wand into the rectum. So I advise that you become as familiar as you can with a variety of home remedies so that you can be the physician for your own family. And as you apply these remedies to your family, thank our Heavenly Father for His divine grace.